Hi, this is Gabby. I'm here with our patient Jason. He came to us back in June 17th of 2020 with a dog bite to his right hand. He had open wounds, needed surgery, got infected, so he went in for his first surgery on July 9th of 2020. Then he went in for his second surgery on August 5th of 2020, so it's been about 6 months now and he's here to talk about his experience. Go ahead.
Yeah, so I had a dog bite injury, a couple puncture wounds that quickly became infected. I came to Dr. Cohen with all the good reviews that I found online about him, and I was put on antibiotics, which wasn't responding to it. And so then we did sort of an outpatient thing where we opened up the wounds and tried to press everything out, kept on the antibiotics, went over to Meridian Hand Therapy next door, and with Lisa there came up with a treatment plan of doing whirlpool and expressing the wound and dressing it every day. But the bone infection was so severe, it still wasn't really responding until we went to the surgery center next door, and Dr. Cohen cut open the bottom and the top of it and cleaned everything out, and once everything was finally cleaned out, the infection went away and the pain went away with it, and I was left with a large open wound that was totally manageable at that point, even though it was a little scary looking. But I kept doing the treatments with Meridian, whirlpool, and also actually after that first surgery, we went to Dr. Cohen actually drove me over to Dr. Detta's infectious disease specialist over at the Advanced Wound Care Center at Los Robles. He personally drove me there in his car, went to my appointment, met with Dr. Detta, explained everything that's going on with me. It was an amazing, very helpful experience, because at the time, having such a wound of this nature was kind of scary for myself, living with it, but with his help, I was able to get through it, and felt comfortable being handed off, and getting this extra treatment over at the Advanced Wound Care Center, where they did, they came in with a lot more different products, and I also put me on IV antibiotics for 4 weeks, which then also brought me to the vascular specialist, who put a PICC line in my arm, and that whole experience was very good. It was very quick, painless, and then I got hooked up with IV antibiotics there's a pharmacy up in, what is it called? I'm sorry, I forget the pharmacy.
Up in Ventura?
Up in Ventura.
Mm-hmm.
Anyways, I think it was May that works there. They were really good, really helpful, explained all the different types of IV antibiotics that you can get, be it something you change out every 6 hours, or a ball is what I had, which lets it go through you every 24 hours. You have a slow infusion. I really preferred that because it seemed to be less of like a jolt to the system. So then I continued with Dr. Detta and getting my wound closed up and healing, and it was getting to the point where we weren't sure if I was going to have to do a skin graft. So I met with a plastic surgeon consultant, we talked about it. I was a little iffy, and then I talked to Dr. Cohen about it, and he was actually able to do a second surgery on me that cleaned up some of the scar tissue around the tendons, and then was able to also close it up most of the way, so I was able to avoid getting a skin graft. And during that second surgery, I was awake for over at the Specialty Surgical Center, And the staff there was amazing. The anesthesiologist was with me the whole time. I was able to communicate to her immediately if I was uncomfortable. I could hear Dr. Cohen talking, and we made a little video of that. And then, so we were left with a much smaller wound, and I was able to move my hand a lot more. And eventually, with doing Prisma and other stuff with Dr. Dutta, we got this wound completely closed up. And I have most entirely all of my range back. I guess I should mention that when I first came here, my hand was like kind of stuck in this position. Like I couldn't make much of a fist at all to begin with. And after the first surgery that I had, I was able to have most of my range. And then the second one got me this full extension, full upright, which has been fantastic, and I can make a full fist. And so then I continued with therapy throughout the whole process. I was on antibiotics, be it oral and IV, for 4 months, I think. And then once it fully healed up, I went over to Body Logic to get a little more therapy done. They were a little more, what's the word? They were a little more aggressive, thank you. I didn't want to say invasive. They're a little more aggressive with everything. They're really knowledgeable there, Scott and Megan. They do a lot of hand work. They help me out a lot, and now I have like a great system in place of techniques and exercises, and I've been educated in all of it from the staff at Meridian, here at Dr. Cohen's, Body Logic. And with that, I'm able to continue just doing therapy at home, 3 times a day, and keep everything in motion and working really well. And all I have left is just like some scarring, but I came through such a huge ordeal. I'm so happy where I am now.
And how's your pain level now?
It's 0, apart from a little soreness from exercising, but with the infection completely gone, and any sort of static pain is non-existent.
Okay, good. And we're going to be seeing him again in 3 months just for a last follow-up, and if we can show everybody your hand.
Yeah.
So that's what the scar looks like.
There was an incision on the bottom.
It looks very nice and healed.
Yeah.
And then go ahead and make a fist. And then open up. Good. All right, Jason. Thank you so much.
Thanks.